Welcome to the deep dive. You've given us a fascinating pile of articles on current viral outbreaks happening all over the world.
Yeah,
It's a lot to keep up with, right? So today we're going to break it down, look at the hot spots, and try to understand what's really going on.
absolutely.
Ready to dive in.
Yeah, it's important to remember that viruses are constantly evolving and spreading. What we're seeing now is a snapshot of a very complex global landscape.
Okay.
We'll unpack what makes each outbreak unique and why some might be more concerning than others.
You're right. So let's zoom out for a moment. We've got reports from China, Australia, India, Europe, even South America.
Hmm.
It seems like nowhere is immune.
What's fascinating is how each outbreak reveals something unique about the viruses themselves and our global response systems.
Okay.
Take the H5N1 bird flu, for example. Scientists are saying it's just one mutation away from spreading easily between humans.
Okay, one mutation away. That sounds ominous, but what does that actually mean?
Well, think of it like this. Most viruses that circulate in birds can't infect humans.
Right.
But every so often, a mutation pops up that allows a virus to jump species. That's what we saw with the 1918 flu pandemic. A bird flu virus acquired mutations that enabled it to spread efficiently among people, and the results were devastating.
So that's the worst case scenario here. H5N1 mutates, becomes highly contagious among humans, and we're looking at another pandemic.
Potentially. That's why scientists are keeping a very close eye on this particular strain. The UK is already taking precautions, culling birds on affected poultry farms, and securing millions of doses of an H5 vaccine just in case.
So they're not taking any chances. But if there haven't been any confirmed cases of human-to-human transmission yet, shouldn't we just focus on the viruses that are actually impacting people right now?
That's a fair point. But the thing about viruses is that they're constantly evolving. We can't just wait for something to become a problem before we start addressing it.
Right.
We need to be proactive, and that means understanding the potential threats, even if they seem distant.
It's like preventative healthcare, but on a global scale. We need to be vigilant and prepared.
Okay, so we've got bird flu lurking in the background, potentially one mutation away from becoming a major threat. What about the viruses that are already causing problems right now?
Well, let's look at what's happening in China. They're dealing with a surge in respiratory illnesses, especially among children. There's some debate about whether it's human metapneumovirus or HMPV or something else.
So what is HMPV exactly, and should we be worried about it spreading beyond China?
HMPV is actually quite common, and most people experience it as a mild cold-like illness. But for young children, the elderly, and those with weakened immune systems, it can be more serious, leading to bronchiolitis or pneumonia.
So it's not a new virus, but it's hitting vulnerable populations hard, especially in China right now. Does this remind you of any other situations we've seen in recent years?
It does highlight the importance of accurate testing and reporting.
Yeah.
Some initial reports in China attributed the surge solely to HMPV, but the Chinese CDC clarified that influenza was also a major factor.
Without clear data, it's difficult to implement effective public health measures.
That makes sense. And it makes me think about another respiratory virus we're all too familiar with, COVID.
Right.
There's always a new variant popping up, and this time it's XCC.
Yeah.
What makes this one stand out?
XEC is a recombinant variant, meaning it's a combination of previous Omicron sublineages.
Right.
Early data suggests it might be more transmissible, but doesn't appear to cause more severe illness.
What makes this combination of traits particularly tricky for public health efforts?
It's a bit of a double-edged sword.
Okay.
On the one hand, a less severe variant is good news. But on the other hand, increased transmissibility means it can spread more easily, potentially leading to more cases and putting a strain on healthcare systems.
Yeah.
And it also increases the chances of the virus mutating further, creating new variants.
It's like we're in a constant arms race with this virus. And while the world might be moving on from pandemic mode, it seems like COVID is here to stay, at least for the foreseeable future.
That's likely the case, and it underscores the importance of continued surveillance and adaptation. We need to be prepared for new variants and challenges as they emerge.
Speaking of being prepared, let's shift our focus to the United States. It seems like we're dealing with our own trifecta of respiratory illnesses right now: flu, RSV, and of course COVID.
You're right. The CDC is reporting that flu is actually the most prevalent at the moment, which might come as a surprise to some people.
Flu being the bigger problem than COVID, that is surprising. Why do you think that is?
There are probably a few factors at play.
Okay.
People might be less vigilant about flu prevention measures now that the pandemic isn't at the forefront of everyone's minds.
Right.
Also, immunity to flu may have waned over the past couple of years due to reduced exposure.
So we let our guard down a bit, and now flu is taking advantage. What's the situation in hospitals? Are they feeling the strain?
The CDC estimates there have already been millions of flu cases this season, with tens of thousands of hospitalizations and, unfortunately, thousands of deaths. So, yes, hospitals are definitely feeling the pressure.
That's a stark reminder that even though we're tired of viruses, they're not tired of us.
Exactly. And it reinforces the importance of getting your annual flu shot. It's not just about protecting yourself, it's about protecting those around you who are more vulnerable.
You've mentioned vulnerable populations a few times now. It seems like certain groups are always hit harder during these outbreaks.
That's unfortunately true. The elderly, young children, and those with underlying health conditions are often at increased risk of severe illness from these viruses.
And it's not just about age or health status,
Yeah.
right? Access to healthcare, socioeconomic factors, even where you live can play a role.
Absolutely. Social determinants of health have a huge impact on how people experience and cope with these outbreaks.
So it's not just about the viruses themselves, it's about addressing these systemic issues that make certain populations more vulnerable.
Okay, we've covered a lot of ground with respiratory viruses. But before we move on to some of the more exotic outbreaks happening around the globe, there's one more common virus I want to touch on, norovirus,
Norovirus, the notorious stomach bug.
the one that shall remain nameless in polite company.
Right. It's highly contagious and can spread like wildfire, especially in closed settings like schools, cruise ships, and nursing homes.
So why are we seeing a surge in cases now?
Norovirus is more common during the colder months, and immunity from previous infections can wane over time, leaving people susceptible.
Right.
Plus, it only takes a tiny amount of the virus to make someone sick, and it can survive on surfaces for quite a while.
Okay, so it's hardy, contagious, and makes you really sick. What can we do to protect ourselves? We've heard wash your hands a million times, but is there anything else?
Hand washing is definitely crucial, especially after using the bathroom and before eating.
But you can also disinfect surfaces frequently, especially those that are touched often. And if someone in your household gets sick, try to isolate them as much as possible to prevent the virus from spreading.
So good hygiene and a bit of quarantine can go a long way. And if you do get sick, what's the best way to weather the storm?
Hydration is key.
Right.
Norovirus causes vomiting and diarrhea, which can lead to dehydration, so make sure you're drinking plenty of fluids, especially electrolyte drinks.
It sounds like the advice for most stomach bugs. Rest, fluids, and ride it out. But it's a good reminder, especially with all these other viruses circulating. It's easy to forget the basics when you're worried about the next pandemic.
It's true, but sometimes the simplest solutions are the most effective.
All right, we've covered a lot of territory here in the U.S. We've got flu surging, COVID still lingering, and norovirus making an unwelcome comeback.
Yeah.
But it seems like the real action, and maybe the scarier stuff, is happening outside the U.S.
You're right. We're seeing some concerning outbreaks in other parts of the world that highlight the interconnected nature of global health. These outbreaks might seem far away, but they serve as a reminder that what happens in one part of the world can quickly impact the rest of us.
Okay, let's take a trip around the world then. Where should we start?
How about Africa? Rwanda is currently battling an outbreak of Marburg virus, a hemorrhagic fever virus that belongs to the same family as Ebola.
Marburg virus. That sounds pretty serious. Is it as deadly as Ebola?
It has a fatality rate of up to 88%, so yes, it's extremely dangerous.
Wow.
The virus causes severe bleeding, organ failure, and in many cases, death.
Okay, that's definitely scary. What are the authorities doing to contain the outbreak?
They've been quick to respond, implementing contact tracing and monitoring around 3,000 individuals who may have been exposed. They've also received about 700 vaccine doses for a trial, prioritizing healthcare workers and those in direct contact with confirmed cases.
So they're taking a proactive approach, which is good to hear. But how concerned should we be about this spreading beyond Rwanda?
The WHO has advised against travel and trade restrictions, with Rwanda acknowledging the government's swift and effective response to the outbreak.
Okay.
They believe the situation's under control for now. But as we've discussed, the risk of international spread always exists with these kinds of viruses.
It's a reminder that we live in a globalized world, and these outbreaks can have far-reaching consequences. Okay, moving on from Africa, let's head down under to Australia. They're investigating a potential case of Japanese encephalitis.
That's right.
What is it?
Japanese encephalitis, or JE, is a mosquito-borne virus that can cause severe neurological complications, including encephalitis, which is inflammation of the brain.
Brain inflammation. That doesn't sound good. How worried should Australians be about this?
It's definitely a cause for concern.
Yeah.
JE is a serious disease and there is no cure.
Oh, wow.
Treatment focuses on managing symptoms and providing supportive care.
So prevention is key here.
Absolutely. The best way to prevent JE is to avoid mosquito bites. That means using insect repellent, wearing long sleeves and pants when outdoors, and eliminating standing water where mosquitoes breed.
Right.
There is a vaccine available, but supplies are limited, so it's being prioritized for those at highest risk.
All right, from Australia, let's hop over to India. They're dealing with an outbreak of Nipah virus. What's that?
Nipah virus is another zoonotic virus, meaning it can spread from animals to humans.
Okay.
Fruit bats are the natural host of the virus, and it can be transmitted to humans through contact with infected bats or their fluids, or through contaminated food or water.
So how does it make people sick?
Nipah virus can cause a range of symptoms, from mild flu-like symptoms to severe respiratory illness and encephalitis. It has a high fatality rate ranging from 40% to 75%.
Those are some serious numbers. Where are these cases concentrated, and what are the authorities doing about it?
The current outbreak is centered in Kerala, India, and sadly, a 14-year-old boy has already died from the virus. Authorities are working to contain the spread by monitoring contacts, isolating those who are infected, and trying to trace the source of the outbreak.
So it's a race against time to prevent further infections. Okay, let's shift our attention to Europe now. We're seeing cases of Crimean-Congo hemorrhagic fever, or CCHF, popping up in some unexpected places.
That's right. CCHF is a tick-borne viral disease that's typically found in Africa, Asia, and the Middle East.
Okay.
But recent cases have been reported in Spain and Portugal, which is unusual.
What makes this outbreak in Europe particularly concerning?
Well, for one thing, it's a reminder that these viruses can emerge in new regions, sometimes quite unexpectedly. Also, CTHF is a serious disease with a high fatality rate ranging from 10% to 40%.
So what are the symptoms of CCHF, and how is it treated?
CCHF often starts with flu-like symptoms, like fever, headache, muscle aches, and fatigue. But as the disease progresses, it can cause severe bleeding, organ damage, and shock.
Oh, wow.
There's no specific antiviral treatment for CCHF, so treatment focuses on managing symptoms and providing supportive care.
So prevention is key here as well.
Absolutely. The best way to prevent CCHF is to avoid tick bites. That means wearing long sleeves and pants when you're in grassy or wooded areas, using insect repellent, and checking yourself and your pets for ticks regularly.
Okay, so we've traveled from Africa to Australia, India, and Europe. It seems like these viral outbreaks are truly a global phenomenon. But before we wrap up this world tour, there's one more stop I want to make. It's a place that might not be on everyone's radar, but it's a hotbed of emerging infectious diseases.
I'm intrigued. Where are we heading?
To South America.
Okay.
Specifically, we're going to talk about a virus called Oropouche. Now, I'll admit, I had never even heard of this virus before you handed me these articles, but it sounds pretty concerning.
Oropouche virus is definitely one to watch. It's a mosquito-borne virus that's been circulating in South America for decades. But it's been getting more attention lately because of its potential to cause large outbreaks and its ability to spread to new regions.
So what are the symptoms of Oropouche virus and how is it treated?
Oropouche virus infection typically causes flu-like symptoms, such as fever, headache, muscle aches, joint pain, and fatigue. Some people also experience a rash.
Okay.
In most cases, the symptoms are mild and resolve within a week or two. However, some people can develop more severe complications, such as meningitis or encephalitis.
Okay, so it can be pretty nasty. But why is it getting more attention now? What's changed?
There are a few reasons.
Okay.
First, there have been some large outbreaks of Oropouche virus in recent years, affecting thousands of people in Brazil and other South American countries. Second, there's evidence that the virus is spreading to new regions.
Okay.
There have been reports of travelers returning from South America with Oropouche virus infection, which raises concerns about its potential to spread globally. And third, there's still a lot we don't know about this virus. We need more research to understand its full potential and how to best control it.
So it's a bit of a mystery virus, but it has the potential to cause big problems. What's being done to prevent the spread of Oropouche virus?
The primary focus is on mosquito control, similar to what we discussed with Japanese encephalitis. That means reducing mosquito breeding sites, using insect repellents, and wearing protective clothing.
Okay.
There is currently no vaccine or specific treatment for Oropouche virus infection, so supportive care is the mainstay of treatment.
Okay, so we've taken a whirlwind tour of viral outbreaks happening all over the globe. From the familiar threats of flu and COVID to the more exotic and concerning Marburg and Oropouche viruses, it's clear that we're living in a world where infectious diseases are a constant threat.
That's right. And this global tour highlights a few key points.
Okay.
First, viruses don't respect borders. They can emerge anywhere and spread rapidly,
Right.
especially in our increasingly interconnected world. Second, we need to be proactive, not reactive, when it comes to global health security.
Yeah,
That means investing in surveillance, research, and public health infrastructure.
right.
And third, we need to be prepared for the unexpected. New viruses are constantly emerging, and we need to be ready to respond quickly and effectively when they do.
Those are all important points. But before we get too overwhelmed by the sheer scale of this global health challenge, I want to bring it back to a personal level.
That's a good idea. Sometimes it's easy to get lost in the big picture and forget about the individual impact of these outbreaks.
Exactly. So, for our listeners out there, what are the key takeaways? What can we do as individuals to protect ourselves and our communities in this ever-evolving landscape of viruses?
That's a great question, and it's one we'll be delving into further in the next part of our deep dive. We'll explore practical tips for staying informed, assessing your personal risk, and taking steps to protect yourself and your loved ones.
Stay tuned for part 2, where we'll equip you with the knowledge and tools to navigate this world of viruses safely and confidently.
Welcome back to our deep dive into the world of viruses.
It feels like we've already covered so much ground, but I know there's still more to explore. Before we get into the practical tips for protecting ourselves, I want to go back to something you mentioned earlier. The idea that these outbreaks can reveal weaknesses in our global response systems.
That's an important point, and it's something we've seen play out time and time again. Take the recent Marburg virus outbreak in Rwanda, for example. The Rwandan government responded quickly and effectively, but it also highlighted the limited availability of vaccines and treatments for these kinds of emerging infectious diseases.
So even when countries are doing everything right, there are still gaps in our global defenses.
Exactly. And these gaps can have real-world consequences. We need to invest in research and development to create new vaccines and treatments, and we need to make sure those resources are available to everyone who needs them, not just those in wealthy countries.
That's where the idea of global health security comes in, right? It's not just about protecting individual countries, it's about recognizing that we're all in this together.
Precisely. A threat to global health anywhere is a threat to global health everywhere. We need to work together to strengthen our defenses, share information, and coordinate our responses.
Okay, so we've got a lot to think about on a global level, but let's bring it back down to earth, literally, and talk about what we can do as individuals to protect ourselves in this world of viruses.
The first step is to stay informed. Get your information from reliable sources like public health organizations, reputable news outlets, and scientific journals.
It can be hard to know who to trust these days, especially with so much misinformation circulating online. Any tips for navigating that?
Look for sources that are transparent about their methods and funding. And be wary of information that seems sensationalized or designed to evoke fear. A good rule of thumb is to cross-check information from multiple sources to get a balanced perspective.
That's a good reminder to be critical consumers of information. Okay, so stay informed, check your sources. What else can we do?
Practice good hygiene. We've all heard it a million times, but it's worth repeating. Wash your hands frequently, especially after using the bathroom and before eating. Cover your coughs and sneezes, and avoid close contact with people who are sick.
You know, we've talked about hand washing so much in this episode, and I'm sure some listeners are rolling their eyes, but remember that time we all got sick after that conference? I swear it was because nobody was washing their hands.
I remember that. It was a rough week. But it's a perfect example of how easily viruses can spread, even in seemingly harmless settings.
Okay, point taken. Hand washing is important. What about masks? Are those still a good idea, even though mask mandates have been lifted in most places?
Masks can be an effective way to reduce the spread of respiratory viruses, especially in crowded indoor settings. If you're feeling under the weather, wearing a mask is a considerate way to protect those around you. And if you're in a high-risk group or are concerned about exposure, wearing a mask in public places can provide an extra layer of protection.
So it's a personal choice, but it's good to have that option available. What about vaccinations? Those are still our best bet for preventing serious illness, right?
Vaccines are a cornerstone of public health. They've saved countless lives and have been instrumental in controlling and even eradicating some of the most devastating infectious diseases in history.
But there's a lot of misinformation and skepticism around vaccines these days. How do we make informed decisions about vaccines when we're bombarded with conflicting information?
It's essential to rely on evidence-based information from credible sources such as your doctor, public health officials, and scientific organizations like the CDC or the WHO. Vaccines undergo rigorous testing and safety protocols before they're made available to the public, and the benefits far outweigh the risks.
You've mentioned the CDC and the WHO a few times now. Can you talk a bit more about the role of public health organizations in responding to these outbreaks?
Public health organizations play a crucial role in tracking and responding to outbreaks. They monitor disease trends, conduct surveillance, investigate outbreaks, develop guidelines and recommendations, and work to educate the public.
So they're like the detectives of the disease world?
That's a good analogy. They're constantly gathering clues, piecing together the puzzle, and trying to stay ahead of the next outbreak.
It seems like a daunting task, especially with so many viruses circulating and new ones emerging all the time.
It is. But these organizations are staffed with dedicated professionals who are passionate about protecting public health.
Okay, so we've talked about staying informed, practicing good hygiene, and trusting the experts. But what about the mental and emotional toll of living in this world of viruses? It can be stressful and anxiety-provoking, especially when we're constantly bombarded with news of outbreaks and new threats.
You're absolutely right. It's important to acknowledge that these outbreaks can have a significant impact on our mental health.
Any advice for managing that stress and anxiety? I know I sometimes feel overwhelmed by it all.
It's essential to take care of your mental health just as you would your physical health. Make sure you're getting enough sleep, eating healthy foods, exercising regularly, and staying connected with loved ones. If you're feeling overwhelmed, don't hesitate to reach out to a mental health professional for support.
That's good advice. We need to remember to take care of ourselves, both physically and mentally. But what about the bigger picture? What can we do to advocate for policies that support global health security and address the systemic issues that contribute to the spread of these viruses?
That's a crucial question. We need to engage in constructive dialogue, support organizations that are working to address these challenges, and hold our leaders accountable for making decisions that prioritize the health and well-being of our planet and its people.
It sounds like it's going to take a collective effort to build a healthier and more resilient future.
It will, but I'm optimistic. We've faced down major health challenges before, and we've learned valuable lessons along the way. We know that with collaboration, innovation, and a commitment to global health security, we can overcome even the most daunting obstacles.
Okay, I'm feeling a bit more hopeful now. It sounds like we have the tools and the knowledge to combat these viruses, but it's going to take a global effort to make real progress. You mentioned earlier that these outbreaks can reveal weaknesses in our global response systems. What are some specific areas where we need to improve?
There are several areas where we can strengthen our global defenses. One is surveillance. We need robust systems in place to track the emergence and spread of viruses so we can respond quickly and effectively.
It's like having a global early warning system for outbreaks.
Exactly. We also need to invest in research and development to create new vaccines, treatments, and diagnostic tools. And we need to improve communication and coordination between countries to share information and resources more efficiently.
That makes sense. We need to be able to share information quickly and effectively to stay ahead of these outbreaks. But information sharing is only part of the solution, right? We also need to make sure that everyone has access to essential health care, regardless of where they live or their economic status.
You're absolutely right. Access to healthcare is a fundamental human right, and it's essential for protecting global health security. When people don't have access to basic health care, it creates a breeding ground for infectious diseases.
So it's not just about developing vaccines and tracking viruses, it's about addressing the underlying social and economic factors that contribute to the spread of these diseases.
Exactly. We need to take a holistic approach to global health that considers the social, economic, and environmental factors that influence disease outbreaks.
That's a big task, but it sounds like it's essential if we want to truly protect ourselves from these threats.
It is, and it requires a commitment from governments, organizations, and individuals around the world. We all have a role to play in building a healthier and more resilient future.
Speaking of building a healthier future, we can't ignore the elephant in the room, or maybe we should say the mosquito in the rainforest. Climate change. We touched on it earlier, but can we dig a little deeper into how climate change is impacting the spread of these viruses?
Of course. Climate change is one of the biggest challenges facing humanity, and it has the potential to impact our health in many ways. including the spread of infectious diseases.
Okay, so how exactly does climate change make it easier for viruses to spread?
As temperatures rise, the habitats of disease-carrying insects like mosquitoes and ticks can expand. This means they could potentially spread to new regions, bringing with them the viruses they carry.
So we're essentially creating more breeding grounds for these disease vectors.
That's one aspect.
And-
But climate change can also lead to more extreme weather events like floods and droughts, which can displace populations and create conditions that are ripe for disease outbreaks.
I see. So it's a combination of factors. Expanding habitats for disease-carrying insects, more extreme weather events, and disrupted ecosystems.
Exactly. And all of these factors can interact in complex ways to increase the risk of disease outbreaks.
So what can we do about it? Is it too late to reverse these trends?
It's not too late to act. We need to take steps to mitigate climate change by reducing greenhouse gas emissions and transitioning to cleaner sources of energy.
That's a big task, but it sounds like it's essential if we want to protect ourselves from these health threats.
It is. And it's not just about protecting our health. Climate change has the potential to impact every aspect of our lives, from our food and water security to our economy and national security.
So it's a multifaceted issue with far-reaching consequences.
It is. And it requires a comprehensive response that addresses both the causes and the consequences of climate change.
Well, we've covered a lot of ground in this episode. We've talked about specific outbreaks happening around the world, explored the interconnected nature of global health security, and discussed the impact of climate change on the spread of viruses. I have to admit, it's a bit overwhelming to think about all of this.
It can be. But it's important to remember that we're not powerless in this fight. We have the knowledge, the tools, and the resources to make a difference.
So what's the takeaway message for our listeners? What can we do as individuals to protect ourselves and contribute to a healthier future?
I think the most important thing is to stay informed, practice good hygiene, and support public health measures.
Those are great starting points. But it also sounds like we need to think bigger, to advocate for policies that address climate change and health disparities.
You're right. We need to engage in constructive dialogue, support organizations that are working to address these challenges, and hold our leaders accountable for making decisions that prioritize the health and well-being of our planet and its people.
Well, you've given us a lot to think about in this deep dive. It's been a fascinating, albeit slightly alarming, journey through the world of viruses. But there's still one more piece of the puzzle we need to address. Earlier, we talked about the idea of shared responsibility in a globalized world.
That's right. It's a concept that's central to addressing these global health challenges.
Okay, so let's dive into that a bit more in the final part of our deep dive. We'll explore the ethical and logistical challenges of sharing information and resources in a world where national interests often collide with global health priorities. And we're back for the final part of our deep dive into this world of viruses.
It's been a wild ride, right?
Yeah.
We've gone from something like the common cold to viruses that sound like they're straight out of a sci-fi movie.
It really has been. And you know what? It highlighted something pretty important. We've all become really familiar with just how interconnected the world is, especially when it comes to our health. Something that starts as an outbreak on one continent can quickly become a global concern.
Exactly. And that brings us to this idea of shared responsibility. It's easy to just say, we're all in this together, but what does that actually look like, when it comes down to it, especially when countries have their own priorities and resources to consider? That's the core of it all, isn't it? How do we balance national interests with global health needs? It's a really complex ethical and logistical challenge, and it's one that often leads to those difficult decisions.
Let's take vaccines, for example. We've seen how critical they are in preventing serious illness and death from these viruses. But not everyone has equal access to vaccines.
Right.
Some countries have stockpiles, while others struggle to get even basic supplies.
That disparity is a major problem. You're right. It's not just about developing vaccines. It's about ensuring equitable distribution. And that's where things can get a little tricky, There are questions of cost, logistics, and even political will.
Okay, so we've got the haves and the have-nots when it comes to vaccines, but there's also the issue of information sharing.
Right.
How do we ensure that countries are transparent about outbreaks, especially in those early stages when it might be tempting to downplay the severity of the situation?
Transparency is absolutely essential. Remember we talked about the importance of early detection and response? Well, that hinges on countries being open and honest about what's happening within their own borders.
But there's always a risk, right? Countries might worry about economic repercussions, travel restrictions, or even damage to their reputation if they're seen as having a disease outbreak.
Those are valid concerns. And it's why building trust and collaboration between nations is so crucial. We need to create a system where countries feel safe reporting outbreaks without fear of punishment or isolation.
So it's almost like we need a global health pact, a commitment from all countries to work together, share information, and support each other in times of need.
I think that's a great way to put it. A global health pact that prioritizes the well-being of all people, regardless of nationality or geographic location.
But a pact like that would require a major shift in mindset, wouldn't it? We'd have to move away from this every nation for itself mentality and embrace a more collaborative approach.
It would definitely require a shift in thinking. But I believe it's a shift we need to make. The interconnectedness of our world, as we've seen time and time again with these outbreaks, demands a more collaborative and compassionate approach to global health.
I think you're right. We can't keep operating in silos, hoping that these outbreaks will stay confined to certain regions. It's simply not realistic in today's world.
And it's not just about practicality, it's about ethics. We have a moral obligation to care for one another regardless of borders or political differences.
Well said. But even if we all agree that global cooperation is the way forward, there are still logistical challenges, right?
Yeah.
How do we actually put these grand ideas into action?
It's a complex undertaking, but there are concrete steps we can take. We need to strengthen existing global health organizations like the WHO, provide them with the resources they need, and empower them to act swiftly and decisively. We also need to invest in research and development, not just for new vaccines and treatments, but also for better surveillance systems and diagnostic tools.
And we need to ensure that those resources are distributed equitably so that everyone has access to the tools they need to protect themselves.
Absolutely. Equity is paramount. We can't afford to leave anyone behind in this fight.
Well, I think we've covered a lot of ground in this deep dive. We've explored the science behind these outbreaks, the complexities of global health security, and the ethical considerations of shared responsibility.
It's been a thought-provoking conversation, and I hope it's left our listeners with a deeper understanding of these challenges and a sense of empowerment to act.
I agree. It can feel overwhelming at times, but I think it's important to remember that we're not powerless in this fight. We can make a difference, both as individuals and as a global community. So as we wrap up this deep dive, I want to leave our listeners with one final thought. We've talked about the importance of global cooperation, information sharing, and equitable access to resources.
Right.
But ultimately, this comes down to a fundamental question of values.
What values do you mean?
Values like compassion, empathy, and a sense of shared humanity. If we can cultivate these values, I believe we can create a world where everyone has the opportunity to live a healthy and fulfilling life, free from the threat of these devastating viruses.
That's a powerful message, and one that I wholeheartedly agree with. It's a reminder that this isn't just about science and logistics. It's about who we are as human beings and the kind of world we want to create for ourselves and future generations.
Well said. And to our listeners, we encourage you to keep thinking about these issues, stay informed, and be proactive about protecting your health and the health of your community.
Absolutely. Knowledge is power, and together we can make a difference.
Thanks for taking this deep dive with us. Stay healthy out there.